From VXPass, let's welcome EHR Data's president, Steve Lawrence.
Thank you, Jimmy. We have a fundamental problem in healthcare, and it really is all of us that are consumers of healthcare, no matter where you are, if you're in the U.S. or other places. The data that you've created over your life for all of your health issues, you have no control over. And so Jimmy talked about data silos. No place are data silos more visible than healthcare. So in Miami, I was talking to a person that had a lot of health issues, lived in the Northeast, had recently moved to Miami, and guess what? No health records came over. He has new physicians that have no idea what the physicians before them said. He calls the physicians in the Northeast to try to get records. They really don't want to send them to him, so they start all over again. So that's a real problem. And so our founder had a vision. Sadly, he passed away last year, but he had a vision to basically give people control of the health records. We have taken that vision and going to try to create something that's commercial to get there, because we know that we can't tomorrow give all of you all your health records and you own it and you control it. There's too many people involved, much like in the blockchain world. There's a lot of people that like small blocks, right? Yes. There's a lot of people that don't want you to have control of your healthcare records. So we're going to solve problems for people that are paying the healthcare bill to ultimately get you your healthcare records so that you can own them and they're mobile and you can take them with you. So the solution is fairly simple. I mean, most of the people in EHR Data have been in healthcare IT all their careers. I spent most of my career in healthcare IT. I spent many, many years with Cardinal Health through distribution and also IT, working with pharmacies, physicians, hospitals. And what we've created is an all-in-one utility that much like people talked today, is with the use of APIs, we can connect into all the places in healthcare and collect your data. Recently, that's been made possible by a lot of the things, regulations that have happened, especially here in the US. In other countries, there's people that really want this to happen, and so the governments are wide open to giving you your healthcare records. We also want it to be one single source of the truth. It has to be accurate. You can't have your healthcare record and put in your own prescriptions. Who knows if it's accurate, right? So it's got to come from a trusted healthcare professional, and it's got to be verified, and we'll make sure that that happens with the data. We want to use blockchain for a lot of different reasons. Obviously for the mutability and auditability of the data, but also for the low cost of rewards. And so a lot of things they talked about before, we've been waiting for in-chain to develop to become part of our application, because if we write a hash to the blockchain on healthcare data, one, it's voluminous, so you can't pay very much. So a good example is last year in the US, there were a little over 4.5 billion prescriptions dispensed in the United States. There were over 1 billion physician visits by people in the United States. That didn't even count surgeries and all the other things. So when you start writing that kind of volume of data, you have to have something that you can write a lot of data to at a very low cost and a fixed cost. So blockchain is very, very important to us. We need it to be customizable because the people that are going to use the data, besides just yourself, so all of the healthcare medical providers and professionals need the data to tell them something. So I had a question in Miami that was really good. There's tons of data, and the question was basically, what are you going to do? You're going to put more data in front of a doctor. A doctor has so much data and they don't have time. That's not the issue. What we want to do is we want to put information in front of the providers so they can make better healthcare decisions at lower cost. The data doesn't mean anything. Today, a physician knows what prescriptions they've written for you, and they know what diagnosis that they gave you when they saw you last. They don't know if you got those prescriptions filled. They don't know if you're getting your refills. They don't know if you saw another physician outside of a different network that's not on their EMR system and what they prescribed for you. So when you think about that, how can that provider make a good business decision and a good healthcare decision for you and lower the cost. So the customizability will allow us to build clinical rules engines on the data to take that data and turn it into information so that the providers can make better decisions. So that's a critical component. Here's a graphic basically of what it looks like. We obviously have a data collection tool. The use case that we're talking about today is a patient at the top of this. The way our system's built, you can basically put anything at the top of this. But right now we'll talk about a patient. So you have a patient. We have an API, a permissioned API that goes out and talks to all the different lab systems, EMRs, pharmacies, to pull in data so that you have the data. It connects to a digital wallet for rewards, there's things that if you're at risk, if you're a high-risk person and the provider's at risk, they can reward you for better behavior. If you could lower your healthcare costs and they're at risk, you lower their costs, which ultimately makes them profit. So with that, we have, as I said, the customizable rules engine. As data comes in and data goes out, many customizable sets of rules can be run against that data to make sure it's accurate, all kinds of things. If you get into clinical rules engines, there's all kinds of clinical analysis that can be done with the data as it comes in, as it goes out, and as it sits in the database. So these could be time-bound or transaction-bound. Annotations, so the data can be sent out for annotations. So x-rays, cancer screens can be sent to a specialist that can make annotations on the graphics, put it back into your database. That then goes with you. So if you move from the Northeast to Miami, now you have your record, you have all of your x-rays, your cancer screenings and annotations and all your prescriptions and everything. So the rules engine can also have notifications. So obviously we talked about payers that are at risk. Notifications can be sent that if you're an elderly person and you had a doctor's appointment today and you didn't show up at the doctor's office. Well, that payer needs to know, because if not, you're going to be in the ER. So you had that doctor's visit for a reason. If you didn't show up, they need to get a van out to your place, pick you up and take you to the doctor. If not, that $100 doctor visit is going to become a $20,000 hospital visit. So notifications are really important to the healthcare professionals. Rewards, we talked a little about the rewards. Low-cost rewards, being able to send micropayments to you for certain things. Plus, as we build this out and you actually own your data, you can monetize your own data. So long ago, my brother and I started a pharmacy software company. One of our goals was to get rid of a thing called a bait stamp. So you all may not know what that is, but long ago, they used to stamp a prescription with a number on it, and it would flip. I mean, that's like so archaic. Now the computer does it, right? Well, if I ever walk in a doctor's office and hand me another clipboard, I'm going to smack somebody with it. This is 2021, and you're getting handed a clipboard to write your name out. You've seen this physician for 20 years, and it's your physical, and you get to write your name and your address and your health insurance. Why wouldn't on your phone you just have a QR code that they scan and it downloads to it? Because you saved them a ton of money. Somebody's got to take that clipboard and put it into your record. That somebody costs a lot of money. Why wouldn't you get credit? Maybe it's just $1. They don't have to pay me. Just get rid of the darn clipboard. Just scan my QR code. It has my medical information, everything about me. So those are all some of the things that we're talking about. I talked a little bit about blockchain. Why BSV, I think, is really important. We looked at a lot of different blockchains. Obviously, we think it's really important. The rewards are a really, really important thing in healthcare. Incentives are important for people to live a better life, take care of themselves, watch their weight, watch their A1C. If they can get incented and you can gamify it, you actually have better outcomes. There's been many studies that show that. So that's a really important piece. Plus, nothing's more important than your healthcare data. So to be able to audit it and make sure that it's immutable is critical. And so as we look through the different blockchains, there really isn't any other alternative other than BSV. With the amount of data that we write and the security around BSV, it was the only alternative for us. So the transaction fees, as I talked about, we're dealing with business. We're taking, as many of the companies we talked this morning, We're taking blockchain into real business. And Jimmy said it earlier, a business can't pay a variable fee. They've got a budget to hit. So they need to know, I've got, if I'm a pharmacy chain and I have 1 billion prescriptions a year, I need to know if I'm going to write that to the blockchain, what's it going to cost me? If it's 1/100 of a cent per transaction, okay, I can live with that and I can budget that. But if it goes from 100 cents to 70 cents to $1 to 40 cents, I'm not going to play in that world, so I'm out. The secure and safe healthcare data we talked about, and then the scalability is critical. I talked about the number of transactions we're talking about with people. Just in the US, you got over 300 million people. Each one of them, on average, is taking 3 to 4 medications. They're seeing a couple doctors a year. That's a lot of data, and especially the elderly and the sick. There's a lot of data, so the scalability has to be critical. We couldn't build this on something that 2 years from now is like, oh, sorry, you're out. Then we got to rebuild everything. So these are the reasons why we picked BSV. So that's what, hopefully that tells you a little bit about what EHR data is all about. We're hoping to change the way healthcare data is used. And ultimately, the goal is to give you, the consumer of healthcare, ownership of your data. So with that, Jimmy.
Thank you very much. Thank you. Now we're going to hear about another healthcare use of the BSV blockchain, which relates to tracking COVID vaccines, which we know is especially important in places here like New York City now. So to talk about that is the founder of a company called VXPass, and he is here from Florida. Please welcome Zach Weiner. Thank you. And he has a jacket today.
Thank you. Yeah, today, first time ever. Is this thing on?
Yes. Yes.
Yeah? Okay. Rather than walking you through these slides slide by slide, you've heard a lot of the same sort of repetitive themes here. Integrity, access, ability, auditability, verification. You're going to hear and see these things across all of the businesses that operate on BSV. They're part of the reasons why we chose BSV, but they become even more important as we drill down into the minutia of what it takes to operate a business, right? So I've heard a number of these topics that we choose BSV because we're regulation friendly. They're easy for governments to audit. It's easy for other businesses to audit, if you're an accounting firm, say. When we talk about integrity, the closer the integrity of the data comes to how you live, the more it affects what your outcomes are as an individual, whether that be happiness, health, business success, staying out of jail, whatever your goals are. And then a lot of the things that you'll hear from all of the business owners is the ability for the consumer to choose, freedom of choice, right? So I'll tell you a little bit about me. I am in this case, right? So I got my first vaccination here in New York City. I was born here. And we quickly moved to New Jersey, where I got a second set of vaccinations. About 4 years later, we moved to Arizona, where I got a third. And then we settled in Florida, where I got the rest of them, my childhood vaccinations. So I don't have a single vaccination record set for myself. In addition to that, when I was in Thailand a few years ago and I wrecked a scooter, they gave me a whole bunch of other vaccinations that I actually just have no record of now, right? So without the actual information, the time and order in which it happens, and the ability to share that to somebody who's a professional or an expert in the field, you don't really have the level of agency over your decision makings that we tend to believe that we have. Right? We can only make decisions with the data that we have access to and can believe in. So if you don't have access to the data and or you can't believe it, you can't be making the right, proper, or most beneficial decisions. There are a couple of other things I wanted to clear up. So we say tracking and tracing a lot, specifically when it comes to COVID vaccinations, right? But with the blockchain, we get a couple of really nice features, which means I can decouple your personal ID from your actual blockchain record. So while you might be able to track the number of doses given or the number of doses distributed in a specific place, we can't actually trace who you are and who you've come in contact with, because that would open the door to potentially the type of outcomes that none of us in this room want to see, right? So it's my opinion, and it's the opinion of VXPass the business, that separating your personal identity from the records that you own is important in making sure that we contain and retain that autonomy and agency over how we make decisions. So VXPass was created in the USA. It was born in BSV. But that's kind of a misnomer. So I used to program on Ethereum. I did it for 4.5, 5 years. As we started to change a different business that I was in, I was looking for new blockchains, and I actually overshot BSV to start. So like many of you, as I went to the internet to find the resources, I didn't necessarily find the volume of resources that I was looking for. And I went from Bitcoin, Ethereum, BCH, BSV, ADA, and I'll leave the last one out, and ended up having to come back to BSV because the other chains, although they made claims, couldn't support what we actually wanted to do. And when you want to make a global system that allows people to write records from anywhere on their own time, can't worry about these kind of scaling issues that you might see on other chains. But moreover, as we deal with countries that don't have the financial resources that in America or Germany or the UK have, and we charge less than $1 per record to get these point of care records onto the chain, we can't have a variable cost in our business that goes up to $6, $8, $12, $15. It just won't work. In this particular case, we're talking about vaccines and vaccines during a pandemic. Every minute matters. So in the case of the United States, earlier this year, we were trying to fit as many people through mass vaccination sites as possible. And for every 5 to 10 to 15 seconds that was spent on a patient, that was 5 to 10 to 15 seconds that wasn't spent on the next patient. So literally every second that we saved moved more people through the system. By doing that, we were able to protect more people. So not only did we save doctors, nurses, and medical practitioners time, but we're actually able to link that to saved lives, which is really something that's impressive for technology in general. Now, my company has 3 products that we offer at the moment. At the first level, you can self-attest. You have a vaccination card. It probably looks something like this, right, from the CDC. It's a piece of paper. And much like you heard EHR Data say, and some of the others up here, we leverage the trust of trusted networks that have already been built. So we leverage the trust of doctors, nurses, pharmacists, and other medical practitioners who have a license, who have gone through their training, who have been registered with the state and have been given access by some control authority, whether it's the state or the federal government, to be able to do and write these things. Now, in the base level, you don't need a doctor, but at the same token, we can't verify it the same way. If you enter your own information, I can't, and we can't as a society trust it the same way as we would a doctor. So the next step up is after self-attest, is if you got your vaccination in a place where there is a database system, we can actually pair you with a doctor who has access to the New York, Connecticut, New Jersey, Florida database, vaccination database system, and have them write for you the record on VXPass that you own. They don't own it. They retain almost no reference to it. And now you begin to have some agency over your decision making, even though the action, the injection, happened previously. And then the third one we call care, which is actually at the point of care, which you walk into a mass vac site or your physician's office, you go through the process of whatever it is they need you to do to get into that exam room. And then at the moment the injection is occurring, or actually just before it, you swipe your QR code, a little bit of code runs to make sure that you're not going to get a double dose or the wrong dose, take a little bit of the decision making out of the nurse practitioner, but then ultimately allows them to click a button that says this process is done and send to you your record. They don't own it any longer. It doesn't have your name on it. It doesn't have your birth date on it. But using a digital signature and the authenticated account of the doctor, nurse, or whoever, we can actually put that signature onto the blockchain, allow you to prove what that data was through an integrity check process, so that while your name is never stored on the blockchain, we can prove that this record is yours. That way, we decouple the personal ID from your blockchain ID. We've made this as simple as possible. Blockchain is fairly confusing, right? There's a lot of different flavors. Some do this, some do that. We believe that BSV does all of it the best, largest number of transactions. But as a business, it's important to the consumers of the business. They don't need to learn about the blockchain in order to use the application, right? They want to go about their business, their day, the same way that they did before. So we've made this as easy as possible. And quite literally, from a patient standpoint, once you have that QR code up, and we don't ask you for your phone number, email address, home address, none of that. Once you have that QR code up, all you have to do is scan. And truly, if the doctor's been efficient, all they have to do is hit send. These are all the screens that you might see. It's a 5-screen application. It's very, very, very simple. But we've leveraged the tools that are provided from within BSV, the actual way that the blockchain stores, validates, and hashes data, to allow us to embed some of that information into your QR code so that when you swipe it, either at the doctor's office or at a verifier, you have decided what to share with that verifier, and none of it is sent over a network. This is entirely peer-to-peer. From the provider side, they can do this from a mobile application or a PC or a tablet, but no matter what, they're really only going to see one screen, right? And they're going to be putting in very, very little bits of information. What type of vaccine did you get? When did you get it? What was the date? And some information about you that goes into that digital signature. Now, you've actually shared that information about you by swiping the first time around. Either way, there's only about 3 to 5 screens on any of these applications. And then from a verification perspective, now what you can't see here is that if somebody were to type in the name and hit submit, you can't do a name search. We don't store plain text names. We don't actually store your name at all. But once you have a BSV address or a blockchain address, which is your ID, we can actually verify through this name sig that you see that the information coming up in this screen here, first name, middle name, last name, and the birthday that's provided as well, goes into a algorithm and spits out the exact same thing as that name sig. So if the answer is anything other than what was stored in the record, we know somebody tried to modify it or wrote it from a place that was not authenticated to write this record. We chose BSV because the scale is unbounded. Okay, we've been able to test, it was up to 8,000 records in a block, just from my single personal machine. I'm not gonna bore you with the text on this, but what we're really seeing is that much like in Latin America when the mobile device came out, Latin America went straight for the mobile device. They didn't first go to the PC and then upgrade later. And with some of the smaller countries in Africa that we're working with, we find that they don't have cloud data storage. They don't have medical record systems. So right now is an opportunity for them to go from before PC to post cloud immediately and jump straight to the blockchain. In addition to offering these services to these countries, we actually reinvest in them. So part of our mission is to work for economic development, to grow the ecosystem of people who can contribute to the blockchain and to the blockchain's development. So in addition to being low cost and easy to use, no setup for verification, for a number of the deals that we've struck specifically in Africa, we reinvest up to 26% back into that nation for things like on-ground customer support, level 1 and level 2. Sales and training for other regional national actors. And then, what we really see is that with our first partner, Lesotho, they have a large percentage of their population that needs to cross into South Africa to work. But the South African border is closed because South Africa closed the border. And so for them to trust, for the South African border people to trust that the Lesotho crossing to come to work are not posing a risk to the South African people, they need a system that can span across borders, which most of these data silo systems, specifically in the US, UK, and Germany, don't do. So again, you guys know why we chose BSV. They'll reiterate it all day. The number of doses given for vaccines is incredibly large. Forget about COVID for a second, just the number of vaccines. Aside from the number of vaccines that are given, when we talk about these small nations that don't necessarily have an EHR system or cloud data storage, sometimes what you see is that children, in order to get into school, get the same vaccination multiple times. We've heard horror stories of one child getting 7 of the same vaccine. Now, I don't know about you, but I don't like to take a double dose of Tylenol, right? So I definitely wouldn't want a double dose of a vaccine, and certainly not 7 of them. But what we're seeing is that there's a large growth opportunity outside of COVID to what I'm, I guess, changing to say as to record the unrecorded, to provide a system for people who couldn't have a record of their history before, to have now a record of who they are, where they were, and what they did that's provable. I don't store your personally identifiable information, and we've taken great pains to make sure that we are HIPAA and GDPR compliant. Now, there's a lot more that I could tell you about our deal flow and how we operate. If you'd like to find me, my contact information is right here. But with that said, I'd like to open the floor for questions.
Thank you. Yeah, we'll bring Steve back up too. Round of applause to here, you guys stand. I'm gonna sit here. So, well, it's an important topic, so we'll take a little bit of time to ask take any audience questions. So, before we take an audience question, so Zach mentioned Lesotho. That is their first significant client user of VXPass, which is a small country right in the middle of South Africa. So VXPass has been selected as the application to track the official rollout of COVID vaccines for the country. So congratulations on that. I know
Thank you.
that was a long time in the making. Any questions for either Steve or Zach about healthcare on blockchain, healthcare data? Okay, we'll start with you, gentlemen.
So where do you see the industry going? I mean, two use cases we see, each one has their own chain and own data. Ultimately, the data need to be, as consumer, data is data, right?
They're not different chains. They're all on the BSV blockchain. Different applications, yeah. But that's the idea of one universal blockchain that everyone can access from.
Yeah, but still, again, I'm storing through one application, storing to other application, pulling the data. As a consumer,
you want to see it all together. So, but you're not going to get there today or tomorrow. You might get there, somewhere in the future. But ultimately, you've got to have it in one database that you, the consumer, have access to. You're right. And I think all of what you're seeing in healthcare are use cases to try to get that data outside of the silos it's in today, so that at some point in the future, you will have one patient record that has vaccines, x-rays, prescriptions, everything. That's where it's got to go. But it won't go there until we have a lot of small companies getting the technology out there and getting the data outside of the silos where it is today.
And one of the
You might use different applications
Yes.
to access
Yes.
the different data
And
sets.
that's sort of where I was going with this. So one of the great benefits of blockchain writ large is that your account is just a mathematical function. It's not a sign up on a server somewhere. So if you have a seed, a private, your 12-word passphrase, we can make an infinite number of private keys from that seed, right? So you could use EHR data with a seed at one path, then VXPass with a seed at a different path. So for you, the consumer, you're entering the same password every time, but the application itself knows where to look on the blockchain for your account, right? So you can either separate them by choice or merge them by choice. It's your choice as the consumer owning those accounts.
Yes. Yes.
Zach, this question's for you. So for countries that are less developed economically, what do you see as the biggest challenge of getting them to adopt
Okay.
VXPass?
The question is, for countries that are less economically developed, what do you think are the biggest challenges to getting them to adopt something like VXPass?
I think in our business's experience, and I don't know if this is the totality of it, in our business's experience, getting people to move from not trusting digital to trusting the blockchain, which is hyper digital, has been the biggest hurdle. And that's actually one of the reasons why we chose to write the records in plain text, so that you could go to a What's on Chain or a Run Explorer and literally pull it up for yourself to see this is what's stored here. So a government, for instance, could see this is what's stored here, and they don't have to trust our word for what's behind this encrypted data. They could see it with their own two eyes. And I think that the thing that gets us over the hurdle is actually when we start to express a sentiment of empathy, right? We know that you're doing it this way today because this is how it had to be done. You didn't have the resources to do it some other way. I don't want to chastise any nation or organization for that. Once they
Don't be a colonist, Zach.
Exactly.
Don't be a colonist.
And so once they understand that I'm actually not here to help. I'm here to offer a solution. You could take it or leave it, right? But we're willing to work with you to implement it. That seems to be the piece that's really missing. So, and I don't know for many of these businesses, but rather than just say, here's what we have, you can buy it. Like, we work with the government, we work with the health, in some cases it's an organization, in some cases it's a ministry, to say, this is what we do, this is how the data is stored, this is what you won't be able to do with VXPass, and does this fit the model that works for you? And for a lot of countries that, they've been doing either oral reporting or sending literal paper tallies, any upgrade is better. But convincing them that there's very little risk where there may have been previously, I think, is the biggest hurdle.
Yeah. All right, one question in the back. Yes.
Thanks for the presentation. I think it's pretty good to hear from practitioners like you. Gives us a lot of conviction. So my question is essentially, we understand that there is going to be a paradigm shift of blockchain in the healthcare sector. But you as practitioners, what are the 3 to 5 key user milestones that you think blockchain has achieved in the healthcare space where you think that these should be the key drivers of the conviction that we have of blockchain in the healthcare space?
All right. For the U.S., what are the 3 to 5 key drivers or milestones that have been achieved to move healthcare use on the blockchain? Anyone want to take that?
You want to start? You want me
I'll
to
start. I think the scalability is number one. The volume of data in healthcare is tremendous, so scalability is critical. Low-cost transaction fees, to me, would be the second. And the third is the low-cost micropayment reward system. Can incent providers to incent their patients for better behavior to basically lower healthcare costs. I think those 3 are all critical, and I think that's why it's going to move into healthcare.
So I was also going to go blockchain answer. I thought he was going to take the legal answer. But at least one of those factors is in the last 3, maybe 5 years, I'm not sure what the date was, it's only been that recent that you as an American citizen have a right to own your healthcare data. You've always been able to request it, but there was no mandatory response that was required. And so to me, that was the biggest milestone in moving blockchain forward in healthcare, because there is no way to allow your doctor to own your healthcare data on blockchain, right? You have to own your own records. So without that key piece of legislation or legislative movement, I think we would kind of be stuck in the water here.
Yeah, and people don't know it, but you actually can require your healthcare data electronically, and they have to provide it electronically. Because in the past, you could require it. Here's a folder of all your paper. They actually have to require it electronically. Now, there's a lot of people playing games on, but there's a FHIR interface, but they're implementing a lot of different ways. But we're getting to the point where you can request it, and they'll have to give it to you electronically.
Which would be easier for the provider to fulfill with blockchain.
Absolutely.
Absolutely.